Welcome back to Face It with Dr. G. I'm Dr. G, and we are sitting here together. Well, I'm sitting here with you in our Mashpee Commons G-Face MD location. So excited to switch it up a little bit. We're just excited to have all these windows and people walking by. Like, what are you guys doing in there? It's really awesome. So I thought a cool topic, actually I can't take credit because Rachel, our head of all the things marketing, advertising, social media, videography, photography, gave me this idea. And I thought it was interesting because I'm starting to integrate this into my daily practice and life as well. And this is AI. And as we know, artificial intelligence is starting to take over the world. And it's starting to take over how we do things day to day, very slowly, but actually very rapidly. And I can't remember where I was. I believe I was in Barcelona at the MERTS Expert Summit, and someone looked at me and said, "You don't use AI?" And I said, "Oh, no." And just all of the conversation revolved around the efficiency and the time management and how everything was able to be done so much more quickly, which in my opinion it's a blessing and a curse, because then everything is expected to be quicker and answers are expected more quickly of you. And you just have to work a little faster, but you're also more efficient, but it's all getting faster. So anyway, I thought it'd be cool to type in, or Rachel thought it would be cool to type in a topic into an AI platform that I use, which is ChatGPT. I have it on my computer. I think there's 3 free days. It's free trial for 3 days, and then you pay, the middle one is like $15 a month, $14.99. And there's all different types of things on this platform. It says, "Hi, how can I assist you?" when you get into it. And then it's education and social, work, food, coding. Then you can do essay writing, letter writing, summarizing, poem writing, rewriting and improving, story writing, history, mathematics, language translator. I mean, you just don't even have to have a brain anymore. We just type everything into AI. And this is actually what's going to happen. I was also having a conversation with someone recently about how we're going to look back when maybe our kids are older and they'll say, "Wait, Google? I mean, you had to actually type something in for it to be done or to figure something out. Now we're just gonna have our own AI assistants who'll do everything for us." So hopefully we won't all become robots and have no interactions with people or humans or anybody else, but let's just hope for the best. Okay, so we thought it'd be cool to type in a topic, and I'm gonna analyze what it spits back to me and see if it's accurate. So the one that she thought of, and I agreed with, is what are the top 10 medical aesthetic trends of or in 2024? And once you start playing around with this technology, you'll realize that you put in just the tiniest difference of a word or a different word, and it changes what it spits back to you, which is interesting. It's almost like you kind of get to know your computer a little bit better. So I have my ideas of what the top 10 medical aesthetic trends of 2024 will be, and my prediction is that they're a little bit more on the natural side. We're starting to think more natural, we're starting to think more bioregenerative, and letting our body do the work instead of pumping ourselves full of filler that may look great initially, and then years down the road, even a year later, that hydrophilicity or the water absorbing capabilities of that filler have started to take effect, and the patient looks puffy or boggy. And then they run to you and they want it dissolved, all dissolved. And you're like, oh dear, here we go. So hopefully we're gonna start on a different foot with 2024. So let's see what the computer said. Hopefully you guys are all grabbing your computers and looking at this with me. So it starts out with a little phrase: "While I can't predict the future with certainty, I can provide you with some potential medical aesthetic trends that may gain popularity in 2024 based on current advancements and emerging technology. Here are 10 possible trends to keep an eye on." So number 1, non-surgical body contouring. We love that. We love that it's non-surgical. We love that there's minimal downtime. And they say that continued advancements in non-invasive techniques for reducing fat and sculpting the body may lead to more effective and accessible options for achieving desired shapes. And I think one of the most important things to understand about non-surgical body contouring is this is not weight loss. This is not liposuction. This is contouring. So it doesn't necessarily get rid of the fat. That's why you have to do other things in combination with body contouring. But I do agree. Would I put that as number 1? I don't think so. But maybe, but not in our practice, because we don't focus on the body. We do body work, but we focus on the face and the neck. Okay, so personalized skincare. Number 2 is personalized skincare. With the rise of AI technology, personalized skincare regimens tailored to individual needs could become more prevalent, incorporating factors like genetics, lifestyle, and environmental influences. I agree with that. I think AI could play an important role in customizing skincare for patients. It's a little scary to me because I love that patient interaction. I love talking to them. I love giving my advice and seeing them and getting my hands on them and putting the products on them. But AI could be a good first step for them to get interested and to learn a little bit more about themselves. And that brings me also to the point of our patients are really educated these days. Not only have they usually seen multiple providers, but they are educated on their skin. They listen to podcasts and they go on YouTube and they do their own research. So that pushes us. We have to know what we're doing. We have to know what we're talking about and be professional. So I like that, but I don't want it to take away my role as a provider. So, okay, number 3, combination treatments. Combining different aesthetic procedures or treatments to achieve comprehensive results may become increasingly popular as practitioners explore synergistic effects. I'm very impressed with the verbiage of this document that they wrote me. So combination treatments, yes, I was actually talking to a patient this morning about combination treatments. The best results take different modalities, including things that reduce muscle contraction, therefore reducing lines. Then you also want to combine that with something that stimulates your own collagen, whether that be an injectable or something like radiofrequency microneedling technology. And the best is to do those together and supplementing that with skincare at home, because you must continue this at home and take care of your skin. So yes, it is not a one-shot wonder here. One treatment will give you something beautiful, but the best way is to know and go to a practice that gives you multiple options at the same time and achieve that synergy. So that's great. Number 4, regenerative medicine. Of course, I believe in this. I think it's fantastic. I would put this closer to number 1 in my opinion, and at GFaceMD. Regenerative medicine, the use of stem cells, platelet-rich plasma, and they forgot platelet-rich fibrin in here. How do I give them guidance? They don't have platelet-rich fibrin, which is the new PRP. It's more innovative, it's more concentrated, it's more effective, and it's more natural. It's 100% natural because there's nothing in that tube when we draw your blood and spin it down to get that platelet-rich fibrin product. It's completely natural. PRP does have an anticoagulant in it, citrate typically, that is not your own. So I love that. We love regenerative medicine. We use platelet-rich fibrin, and we also use exosome technology, which are tiny little microvesicles that usually are messages and signals sent between cells in your body for multiple different reasons. They were thought in the past to be trash or waste products, but we now know they aren't. So these little microvesicles are now repackaged and repurposed with a ton of different growth factors that are regenerative and give incredible benefits to the skin. So number 5 is energy-based vaginal rejuvenation. And I would agree with that as well. I think as aesthetic providers, we are really expanding into that reproductive health, vaginal rejuvenation. How can we feel better, sexually, intimately, just about ourselves in general? And I think that's a big topic. And my patients bring that up. We currently don't have that at GFaceMD. Have I thought about it? Yes. Could it happen? Yes, but I don't have it. Currently, we don't offer it, but I do agree that that should be in one of the top treatments of 2024. Number 6 is injectable fillers for hands. And I just spoke with a patient today about her hands. Hands are one of those areas that we don't typically focus on until we're looking at our hands. We're writing, we're like, oh, my hands, they're dry, or just look older than my face. And it's very true, our hands tell our age, and injectable fillers not only can help create collagen depending on the product that you use, but they can create softness and they can create hydration. And hydration's huge. My hands are always dry. I feel like it's hard to keep cream on because then you're greasy and you're putting grease everywhere. And so fillers in the hands are amazing. And we love that here. Number 7, natural looking lip enhancements. If you guys are watching this video, you can tell I just had my lips done yesterday and I love them so much. A little swollen, a little bruised, everything that we expect, and those will go down. And we love lip fillers. We like them to be natural because the last thing you want, or I want, is for a patient that I injected to be my advertisement, and their lips enter the room before they do. And that is not what I want to see. We want to be natural. We want to overall enhance and improve our appearance and not allow certain features to predominate the overall phenotype. So we love that. Something about lip enhancements that we don't always talk about is we can use those bioregenerative treatments in the lips, such as PRP and PRF. Helps naturally stimulate collagen without adding another product, such as a hyaluronic acid-based dermal filler in the lips, which is the typical go-to product for lip enhancements. So PRF is great, as well as hyaluronic acid filler, and then we can also add a nice gloss or lip plumper on top. Number 8, we're getting there, is virtual consultations and telemedicine. I found that to be interesting to be in 2024 because I think we're kind of getting away from those. But if they're meaning that's because of AI, maybe that's where this is geared. But I think 2024 is going to be a year of in-person because 2023 was still a little weird, and 2024 people are so excited about, and I feel the energy different than I did in 2024. So for me personally, I don't want to do telemedicine. I mean, maybe for some things, but I want to be out there and talking to people and getting my hands on people. Number 9, we're almost there, skin microbiome focused products. These are definitely a topic of conversation. I think last year they were as well. So these target the skin's microbiome, or those organisms that naturally exist on the skin surface to help improve the skin barrier, to help fortify the skin and prevent other harsher, toxic, or non-wanted products or materials from getting into the skin. So we love skincare products that help improve the stability and the rigidity of our skin, but also hydrate. So I love that. And then last but not least, integrative wellness approaches. And I totally believe that this is the case. I think this should be number 2 or 1. This is incorporating holistic approaches such as mindfulness techniques, they list here, nutrition counseling, stress management, alongside traditional treatments, because what we do know is that stress is an underlying marker of inflammation in the body. Stress causes inflammation, inflammation causes stress, our external world causes stress, and all of those things accelerate the aging process. So there's a term, inflammaging, right? That baseline level of inflammation in our body can accelerate. That baseline level of inflammation, is that what I said, can accelerate aging. So I agree with that. I think we all have to start taking better care of our minds and our bodies in a different way. Also, gut health is super important and directly connected to the skin health. So I'm definitely going to try to be better about it. I hope you are better about it. I know it's easier said than done. But I hope this was interesting and insightful. I hope this maybe gets you thinking about using AI in a way that could be beneficial for you. We definitely are, and I think it can help you with things like this. So, like, subscribe. I can't wait to see you guys next time.